Welcome to New Hampshire's Business. I'm Fred Coker. There's good news and bad news in healthcare in New Hampshire. The number of uninsured is way up, but the health insurance rates for individuals in the New Hampshire Healthcare Exchange are way down. More working adults in New Hampshire uninsured. You can see the numbers. For 2020, 96,000 New Hampshire working adult population uninsured, 29,000 increase due to a job loss February to May. And then back in 2017 and 18, you can see the difference. There were 77,000 of New Hampshire's total population. That includes seniors and children, as well as working adults, had no health insurance. That's just a comparison of numbers. And then this, a headline you don't see much often in healthcare, 21% rate decrease. 2020, the lowest cost individual silver plan. You can see the number, $404. And 2021 lowest cost individual silver plan goes down to $318. And with me to talk about this is the Commissioner of Insurance in the state of New Hampshire. Welcome to you, Chris Nicolopoulos. Nice to have you.
Thanks, Fred. We're very concerned when people lose their health coverage. And we're closely monitoring that situation. We here at the department meet with all the carriers every other week to discuss COVID issues and membership trends. The good news, if there is any, is that New Hampshire has fewer uninsured than most other states, and options exist. The department recently spearheaded the 1332 waiver program to reduce costs of individual health plans.
The number we just put up with went through May. Is it getting worse or better now in August?
The numbers that you referred to are different from what we've historically used here in the state, and I think over 18 and 19, we estimated about 6% of the adults here in New Hampshire didn't have insurance. And our numbers, our most recent numbers, are about 7%. They're using a different metric, but they're up.
They're up, yeah. And you're including the seniors and children. And the numbers I used were just for working adults. Yeah,
right.
That's a different metric. What about the alternatives now? Of course, you have COBRA. People can go to COBRA when they lose their insurance, but that is pricey for some people. So then they're left with Obamacare. Just talk about that.
Sure. I think people need to weigh all the options when they're dealing with the loss of insurance or loss of job. And the individual marketplace in New Hampshire, as you mentioned, we estimated 20% premium rate reduction for 2021. But probably more importantly is the fact that there are premium subsidies available to New Hampshire residents when you apply for a plan through healthcare.gov. And just to put that in perspective, for a single person who's earning up to 400% of the poverty level, or about $50,000, they would still qualify for a subsidy. For a family of four, that income threshold is up to $100,000. So we recommend that people go to healthcare.gov, apply for a plan. If they do it after November, that will be the 2021 rates. And if they need help through healthcare.gov, they can connect with either a navigator or an insurance agent to help them through that process.
What insurers are in the New Hampshire Healthcare Exchange right now?
Sure. We have three companies in our individual market. Those are Anthem, Harvard, and Ambetter.
Okay. And those are the same insurers that have been there for a while?
They're the same insurers from last year. A couple of years ago, we had a fourth, but right now, the last couple of years, it's been Anthem, Harvard, and Ambetter.
As we go through the fall and winter of 2020 into 21, what do you foresee in terms of a trend here for health insurance rates on any front?
These individual rates that are helped along by the 1332 waiver, we're projecting at 20% down. For group plans, obviously they're not going to benefit from the 1332 waiver subsidy.
It's a waiver from the federal government that you applied for and got.
Right. The 1332 waiver is permission from the federal government to use a little bit of state money with a 2.5 times match from the federal government. They take all of that money and create a reinsurance tool that basically allows the companies in the individual market to have a backstop when they have large losses.
So that's how the rates come down.
That's right.
Yeah. Okay. Okay. Insurance Commissioner, Chris Nicolopoulos, thank you.